I'll start. Good morning to everyone. My name is Sharon Cochran, and I am the chair of the Lake Ridge Health Board. And on behalf of the Lake Ridge Health and the Lake Ridge Health Board, we would like to welcome you to a very, very important celebration of this new long-term care facility or home. And it is a home that has been a collaborative partnership with our provincial, municipal, and construction partners over the last 13 months. And I should begin, it is always a pleasure to be at a special event with the Premier, Doug Ford, Minister Calandra, the Minister of Long-Term Care, Minister Surma, the Minister of Infrastructure, and Minister Elliott, the Minister of Health. And we also have our Durham MPPs, Peter Bethenfalvy and Lauren Coe. I would also like to recognize the leaders from Lake Ridge Health. Dr. Tony Stone, our Chief of Staff, and Cindy Davis, our President and CEO. This new long-term care facility benefits all of the Durham region, and it has enabled health improvements that matter the most. 320 long-term care beds. It has enabled connected partnerships, and I think you've already heard me comment on that. And it has enabled Lake Ridge Health's journey to creating an integrated healthcare system. One system, best health. And I would just like to conclude with just a huge, and I could use the word huge again, thank you to all our partners. This collaboration among all of these partners has enabled us to complete this project on time and to celebrate the upcoming opening. So I'm very pleased to turn over to Premier Ford.
Well, first of all, thank you so much, Sharon and Cindy and Dr. Stone as well, your whole team. Before I begin, I want to say a big thank you to the entire Lake Ridge Health team. All the heroic nurses, the doctors, paramedics, personal support workers, and hospital staff who have gone above and beyond during this pandemic. You showed up day in and day out, and for that, we're forever grateful. It's great to be in Ajax with Minister Calandra, Minister Surma, Minister Elliott, Minister Bethenfalvy, and MPP Lauren Coe. And it's an honor to be joined by Mayor Sean Collier and Cynthia Davis, President and CEO of Lake Ridge Health, as well as CEO of Infrastructure Ontario, Michael Lindsay. Michael, all of you are actually champions. It's hard to believe that when I was here just over a year and a half ago, this was an empty plot of land. It's really incredible what they've built behind us. Seeing a brand new long-term care home here in such a short time, it's truly amazing. From shovels in the ground to substantial completion, it took only 13 months. And if you put that into context, folks, it took 13 months. A typical build will take upwards to 8 years. So again, a big shout out to all the partners involved. This just shows that when we put our heads together, when we look outside of the box for new solutions, when we say yes to building Ontario, we can accomplish great things. Our government's accelerated build pilot program was designed to get infrastructure built in record time. By using hospital lands, modular construction, and speeding up procurement, we saw we could deliver more long-term care beds faster. This is the first long-term care home to be completed under the accelerated build program, delivering 320 new and much-needed long-term care beds to Durham region. providing vulnerable seniors with a comfortable place to call home as soon as March the 31st of this year. I want to put that into context for you. As I said earlier on, between 2011 to 2018, the previous government only built 611 long-term care beds built right across the entire province, less than 1 bed per home. With this project alone, we're adding 320 new modern and comfortable beds. We listened to the call for more long-term care beds to care for our most vulnerable. And after decades and decades of underinvestment from previous governments, we knew we had to take action. We knew we had to get building. We committed $6.4 billion to build 30,000 new long-term care beds by 2028, as well as 28,000 upgraded beds across the province. I'm so proud of the work our government is doing to answer that call. I want to give a big shout out to our partners, Lakeridge Health, and I got to give a special shout out to PCL Construction. This is an incredible firm, folks. You want to get something built on time. They built this in 13 months. I don't know of any other company that could do it in 13 months. I had an opportunity to speak to the frontline construction folks. They're a great team there. And I just want to thank them and all the incredible workers I met here today. Along with Infrastructure Ontario, real champions in getting this project across the finish line. We found bold solutions to build new homes, and this pilot program has shown that it can work and produce results. I can't wait to see the same results as we push forward in other rapid build long-term care homes in Mississauga, North York, and Toronto. They're a critical part of our plan to build Ontario, but we can't build this province alone. We all need to work together to get our seniors off wait lists sooner, to reduce gridlock with roads and highways, and expand public transit. Our government is saying yes to all of that. We're saying yes to building Ontario. I just want to thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Calandra.
Thank you so much, Premier, and thank you all for being here. It's obviously it's great to be here today to celebrate this achievement. As Ontario's new Minister of Long-Term Care, it is of course an honour to continue the important work that was already underway to fix long-term care across the province of Ontario. And of course, we have a plan to fix long-term care and ensure Ontario's seniors get the quality of care they need and deserve both now and in the future. The plan is built around 3 pillars: improving staffing and care, strengthening accountability, enforcement and transparency, and building modern, safe, comfortable homes for seniors. This new home at Lakeridge Health Hospital will be integrated into the broader healthcare system in Durham Region to ensure residents have access to the specialized care they need, such as dialysis. Building more safe, comfortable, and modern beds for our seniors is what Ontario needs, and it has needed this for decades. And we are delivering. Congratulations once again to Lakeridge Health and its partners and your great work to deliver this much-needed home for the community. And with that, I will turn it over to Minister Surma. Thank you.
Good morning. I'm thrilled to join Premier Ford, Minister of Long-Term Care, Paul Calandra, and everyone to see the progress and occupancy at the state-of-the-art long-term care home here in Ajax. We know the past 2 years have been challenging. The pandemic has highlighted gaps in our system that have been overlooked for far too long. Families want to know their loved ones are getting the care they deserve. Families deserve to sleep well at night, knowing their loved ones are safe. Our government is making investments into long-term care that will bring that comfort to families. Normally, it takes 8 years to build a long-term care home in the province of Ontario. Through our collective and collaborative efforts with our partners, together, we built this facility in 13 months. When all parties are working together to achieve the same goal, anything is possible. Over the next few years, we are investing $6.4 billion into long-term care. The pandemic has shown us that there is no time to wait. These investments are needed, and they are needed now. I want to recognize Michael Lindsay, CEO of Infrastructure Ontario, who is here with us today. He is the lead on the accelerated build model and has been working tremendously hard to advance procurement strategies that are innovative and modern. It is through this innovation that we are now able to announce projects like the Lakeridge Health Long-Term Care Home. By cutting red tape and working with our industry partners, we have been able to apply the accelerated build model to 4 new long-term care homes in total in the GTA. In addition to Lakeridge Health Long-Term Care Home, I am happy to share that a total of 1,200 new and upgraded beds will be created at Trillium Health Partners' Speakman site and Humber River Hospital North York campus. Building long-term care is a huge priority for our government, but we are also making other important investments in Durham Region, such as expanding and renovating schools like Teresa of Calcutta Catholic Elementary and Lakeside Public Elementary to accommodate more childcare spaces. Construction of the new Grandview Children's Treatment Center, which will create more treatment spaces and reduce wait times. Building the new Meadows North Public Elementary School that will support the families that call the community home. And improving recreational infrastructure at the Ajax Community Center and downtown Ajax Sports Campus. As I mentioned, these investments are part of our government's larger plan to build Ontario. Together, we will continue to lead the way and build infrastructure that will make our communities stronger, healthier, and more resilient. Thank you.
Okay, we're ready to take questions. We'll be taking questions first here in person, and if we have time, we'll move to the phones. Just a reminder, it's 1 question and 1 follow-up.
Hi, Richard with City
Hey,
News
Richard.
680. How you doing, Premier?
I'm doing good. How are you?
I'm good, thanks.
Good.
Certainly noticed a change in the way you describe the pandemic in the last few days. You've talked about learning to live with the virus. You've talked about returning to life before COVID-19. Yet the science table came out with new modeling this morning that said cases will rise as the current restrictions ease, and hospitals are strained, and they're going to become even more strained. So my question for you is, when you talk about learning to live with the virus, does that mean we're never going to see the type of lockdowns we've seen the past few months? Or what will you do if hospitalizations become troubling again, sir?
Yeah, it was Dr. Moore that said we got to learn to live with it, and I agree with him. But what we're doing, we're putting more money into the healthcare system. We've created 3,100 new beds. We hired 6,700 new healthcare workers. Another 6,000 are on the way. We're building long-term care facilities, rapid builds like this right across the province, investing billions of dollars. We're putting billions of dollars into new hospitals across the province. So are we ready? Yeah, we're ready. We're ready to move forward, but we have to do it cautiously. We can't just jump into it and just open everything up tomorrow. We have to be very, very cautious. We have a strong plan. It's great news that we're opening up. Moving forward, we're opening up on February 21st and then March the 14th. But again, make no mistake about it. The hospitals, they're in better shape, but we still see a little bit of absenteeism. We're still seeing pressure. We're still getting surgeries back up and going. So we're going to be cautious moving forward, but we're going to get there.
Before I get to my follow-up, I just want to be clear. Lockdowns, sure. We could still see it? It's still a possibility?
No, that's not our goal. Our goal is to move forward in a very cautious way to make sure we don't have to have lockdowns. And when we invest into healthcare, there's one thing I keep saying for the last 4 years with all the other premiers from all the provinces and territories from all different political stripes, we need the federal government to pitch in. The CHT, Canadian Health Transfers. Folks, we're getting 22% out of the 100% that we're investing. There's no province, no territory that can sustain the funding. We just can't do it. So we need the federal government to step up and contribute more than 22%. We need ongoing funding from the federal government because we can't take 78% of the burden. They take 22% of the burden and expect to continue to grow and fund the healthcare system.
Premier, I want to ask you about the trucking protest situation in Ottawa. I know you put out a statement yesterday condemning some of those actions. Why did it take you till Monday to put that out? And what is your message this morning to the truckers that remain there?
Well, my message right from the beginning of this pandemic, when it came to the truckers, I appreciate everything they've done. I appreciate them bringing health supplies to hospitals, putting food on the grocery shelves. But there's 3 things I can't tolerate. desecration of any war memorials or any memorials. Zero tolerance for that. You know, what people have to do, and the flags are waving around, is disgusting in my opinion. Outside of the greatest flag in the world, the Canadian flag. God bless them for waving the Canadian flag. But the other thing is, folks, there's 1 million people that live in Ottawa. You know, I hear you. I hear the protesters. The province hears the protesters. The country hears the protesters. Now it's time to let the people in Ottawa get back to their lives. These businesses that have been closed for you know, a while now, the restaurants want to reopen. So, you know, I get it. I hear you. But we have to let the people of Ottawa live their lives.
Hi, good morning, Premier. Our colleagues in Ottawa have confirmed that no one from your office nor from the province reached out to the mayor's office in Ottawa over the weekend to discuss the situation. Mayor Jim Watson received a call from the Prime Minister as an example, but no call from you. So what does that say? I mean, you seem to publicly be telling the truckers to go home, but privately you're not offering any kind of support to the city of Ottawa.
Well, I disagree with that. We have great ministers out right on the road, right in the field. Minister McLeod said a very strong statement, and we have Minister Fullerton there. We're well represented.
But you're the Premier of the
Roberts
province.
And Goldie Gamari. I did put a statement out. I put a very strong statement out yesterday. So at any given time, if the mayor needs our support, he knows where to contact us. He has my cell number, and I put a strong statement. I'm putting a strong statement out today that people have to, you know, move on, let the people of Ottawa live, let the businesses open up, and that's my statement, Colin.
Okay, another question related to Ottawa. I'm sure you're well appraised of what's happening within the Conservative Party currently. The question for you, obviously, because a lot of people have been mentioning your name as a potential successor to Erin O'Toole if things go that way. Do you have any plans whatsoever to step into the Conservative leadership race if there is a race now or sometime in the next 4 years?
No, I have my hands full. I love being Premier of this province. We're going to build this province, and I'm going to continue leading this province. That's my job. I am just, you know, 24/7 working on getting us out of this pandemic. I want to unite this province. I can't stand this divide. When I see this divide in this country and in this province, I want people united. And we're going to get there. We're going to get through this together. We're going to get through it cautiously, but we're going to be united at the end of the day.
Hi, Premier. Matthew Bingley, Global News.
Hey, Matthew.
You talk about the cautious, phased approach to reopening the province, but with the science table pointing to cases that are likely going to rise as we see restrictions ending, and businesses that obviously need people's support, how can you both walk the line of saying get out there and support businesses when we don't have the healthcare capacity at this moment yet? You know, you want to. It seems like they seem to fly in the face of each other. Well,
not necessarily. You know, there's no secret. We have the toughest guidelines in North America. In North America, as everyone's moving forward, we're being cautious. We're making sure we beef up our hospitals with the staff that are needed and well overdue, with 6,700 healthcare workers that we hired, another 6,000 coming on board. We had built 3,100 hospital beds and building billions and billions, spending billions of dollars building new hospitals, building the infrastructure that's needed. But you know who's an expert on this and show him strong leadership from day one, standing shoulder to shoulder with me, is Minister Elliott. Maybe I'll bring Minister Elliott up. Has done an incredible job, Minister of Health.
Thank you, Premier. First of all, we do have capacity in our hospitals, and the Science Advisory Table has basically indicated that it appears that the peak of Omicron has passed. That doesn't mean we're entirely in the clear, of course. We still do have high levels in both our hospitalizations and intensive care units. However, that is starting to decline. This week we've had about 3,000 people admitted to hospital. Last week it was over 4,000. We have capacity. That's why we're doing things like releasing Directive 2 somewhat to allow for some of those procedures that people have been waiting for some time to continue. We're opening up pediatric surgeries, cancer screenings, making sure that we can let independent health facilities operate, private hospitals. All of those things are possible because we do have the capacity that the Premier mentioned. We have created over 3,100 hospital beds, over $5.1 billion, 67 new healthcare professionals into our system, so that even if the numbers do go up slightly as we start opening up, the modeling has been done to indicate that we will still have the capacity to deal with that increase, but also to start to deal with the people who have had procedures or surgeries postponed. So we feel that we are ready for whatever will happen as we move forward.
I have one more question for you, so don't put the mask on yet. When it comes to those surgeries that you're talking about, not all of those procedures have been given the green light. When will people who are waiting and have been waiting for months and months and months actually get a definitive answer when as you mentioned, cases could go back up and could delay those procedures even further?
Well, we are confident that we have the capacity to be able to open up gradually and cautiously in the same way we're opening up the province. Gradually and cautiously, we'll do the same thing with the release of Directive 2 in a tiered approach. We have 4 different tiers leading to ultimately opening everything up so that we can increase those volumes. And as you probably are aware, we put $300 million last July into extra operating times for evenings and weekends to allow us to help serve those people who have been waiting for a long period of time. So we're doing this very cautiously and carefully, making sure we have capacity for people who have COVID and making sure that we have capacity for people who need those procedures and surgeries. And with the information that we've received from the Science Advisory Table and from Dr. Moore, I'm confident we'll be able to deal with that.
Minister, if you stay there just for one moment, thank you so much. Adrian Gober with City News. I'll ask a follow-up question to that. I was speaking with multiple families last week. One family, one gentleman has a sister who has a cancerous tumor on her kidney in need of surgery. He's a small business owner. He understands the need to reopen business, but he also understands the need for his sister to be able to get into a hospital. So while bars and restaurants and other parts of the economy are open today, but his sister's still waiting for surgery, what would you say to that family?
First, I would say that I'm very sorry that people have had to have surgeries and procedures postponed. I know this has been very difficult for individuals and their families. Some have been waiting for a long period of time. But I would also say that although we aren't able to continue with all of the surgeries and procedures right now, they are all very, very carefully triaged. So if someone has a life-threatening condition, they will still be served right away. And so we have many doctors looking at this to make sure that if this young lady were in a life-threatening condition, she would be able to have her surgery right away. So I think it's important to remember that everything hasn't stopped completely. The most serious cases are being triaged and moved forward as quickly as possible to make sure that their lives will be saved. Thank you.
Thanks. Just a question for Premier Ford. Premier, yourself and your government, you've repeatedly chastised the federal government when it comes to border measures. So would it be safe to assume that you then support the federal government's mandate on truckers, similar to the United States, that they must be vaccinated to cross the border? So a clear answer to Ontarians may be beneficial.
Well, I think I've made my statement pretty clear right across the board. I believe in getting vaccinated. You know, I've been on the trucker side, I've always supported truckers from day one, but I support vaccinations. It's very simple. That's how we've been able to slowly get out of this, and that's how we're going to continue to slowly get out of it. People may disagree, one side or the other, but I'm going to support getting vaccinated, and that's no shot against the truckers. I think the world of the truckers. I've supported them from day one and appreciate and very grateful of everything they've done and continue to do throughout this pandemic. Keep in mind, I think it was close to 90% of the truckers are vaccinated, right? So I want to thank all of them.
Okay, we'll move to the phones for questions now. First question, please.
From Karen Howlett at the Globe and Mail.
Hi, Karen.
Hi, Premier. My question is about the upcoming Council of the Federation meeting this Friday. You and other premiers will be calling on the federal government to, as you mentioned earlier in your remarks today, to increase funding under the Canada Health Transfer. There are advocates who are saying that any increase in federal funding should be tied to national mandatory standards for long-term care. So here's my question. What is your position on Ottawa's plan to introduce such long-term care standards across the country?
Well, before I pass it over to the Minister of Health, we're strong believers, number one, all of us, is health is the jurisdiction of the province. In saying that, if the federal government wants to give us additional funding and saying we want to allocate it to long-term care, we welcome that. But really, for decades, and then this is decades, it's not this government, it's this government, the previous government, they're pitching in 22%. We've been preaching this for 4 years. So we got to make a move on this, and the federal government has to pitch in. We've spent billions and billions of, tens of billions of dollars throughout this pandemic, and yes, they've supported us on one-time funding. One-time funding doesn't cut it. We need continuous funding all the way through for many years to come if we want to sustain the increase of money we're spending in healthcare. So I'll pass it over to the Minister of Health.
Yes, healthcare is the responsibility of the province, and as the Premier indicated, if the federal government wants to give us some money for long-term care, well, absolutely, we will take it. But the primary problem is the Canada Health Transfer amount is too low. At 22%, it doesn't cover the increase in costs that we're sustaining in healthcare, and as the healthcare budget increases, of course, that means other important parts of what the government has jurisdiction over, education, infrastructure, everything else, we won't be able to invest those dollars. So what we need in health is sustainable funding through the federal government, increase it from 22% far above what it is right now, because among other things, we're having great medical discoveries, great innovations, great new medications to deal with rare diseases, things like that. Our healthcare costs, our drug costs, our building costs, everything's going up. So we're appealing to the federal government to help us so that we can have a strong, healthy health budget as well as the rest of the items in our provincial budget.
Follow-up, and this is the last
So
question.
as a follow-up, would the province of Ontario work cooperatively with the federal government in introducing national mandatory long-term care standards?
Well, we've been working cooperatively right from day one. From when I first got elected, we were in conversations with the federal government, and it just seems to continue to go year after year after year. And they're kicking the can down the road. That doesn't cut it. We're all united. We have a strong group of premiers, all different political stripes, but we're all united on making sure that the federal government pays their fair share. It's as simple as that. And we're leading the way in new builds. You know, our goal, again, is 30,000 beds by 2028. We're well on our way. We're well on our way to making sure that we continue to build hospitals as well. We've had more builds than ever in the history of Ontario that I can remember, right across the board. But we can't do it alone. We need the Canadian health transfers to increase drastically and consistently, ongoing sustainable funding for the people of Ontario.
Thanks, everyone.
And I got to give a personal shout out. I have one person in the Ford family that's non-political. That's my brother Randy. It's his birthday today. So he's the smartest of the group because he's not involved in politics. Anyways, happy birthday, Randy. All the best.
Thanks, everyone.